I, Kelvin Mills, give Megan Mills permission to record this and submit it for a grade.
Knock, knock, knock. Hello, my name is Megan. I'm a senior nurse today. Can I verify your name and date of birth?
Kevin Mills, 3/26/1986.
Okay, I'm going to close the curtain, provide some privacy, perform some hand hygiene, and put on some gloves. Do you have any allergies?
No.
Okay, and on a scale from 0 to 10, 0 being no pain at all, and 10 is the worst pain you've ever felt in your life, how do you feel today?
I'm at a 0.
0? Okay, and today we're going to be doing a head-to-toe assessment. Is that okay with you?
Yes.
All right. To maintain safety, I'm going to put the bed in working position for my height, and I'm going to lower the bed rails, okay?
Okay.
All right, so if you could go ahead and lay down for me. Okay, I'm going to assess your hair texture. I'm going to assess the hair color, the hair integrity, see if there's any patterns of baldness, and there's not any of the above. I'm going to check your bony prominences, your occiput, your scapula, your elbow, your sacrum, and your heels. I am also going to be assessing your pulses. I'm going to use my bell of stethoscope to osculate your carotid. Okay, I'm also going to assess your radial pulse, and it is for 60 seconds. And I am also going to do your posterior tibial and your dorsalis plexus. And everything is within 60 to 100 beats per minute. It is at 80 and it is 2+ bounding. Okay, so I'm also going to see if you have any dressings, any IV sites. You don't have any IVs. If you did, I would assess the redness, tenderness, location, type of device used. You don't have any drains, you don't have any Foley's or SuperBrick catheters. Your skin color matches your ethnicity. I'm going to assess your skin turgor on your hand and on your clavicle. All right, great. I'm also going to look at your facial expression. Your facial expression matches the pain level given. I'm also going to do a 2-step blood pressure method. I'm going to do this for 60 seconds. Okay, your blood pressure is within normal range. It is 119/79. Your respiratory rate, your respiratory rate is at 18, which is within normal limits of 12 to 20. Your skin turgor, skin integrity is all good. I'm going to assess your capillary refill on the upper extremity and the lower extremity, and those are both at a 2, so it is a good refill. And I'm going to assess for any pitting edema. There is no pitting edema either. Okay, now I'm going to move to the ears. Okay, I'm going to look and see if there is any drainage or any assistive device uses on either side. Okay, and the patient does not seem to be hard of hearing either. While I'm here, I'm also going to perform a whisper test. So I'm going to cover this side. I'm going to whisper 3 objects into your ear. I'm going to have you repeat them to me, okay? Okay, the patient correctly whispered in my ear the 3 objects, and I'm going to repeat it on this side. Okay, the patient correctly whispered to me on that side as well. And while I was doing that, I was assessing the patient's speech, and the patient's speech is not garbled or slurred. His speech is very clear. So now and his ears are also symmetrical. So now I'm going to turn off the light, and I'm going to perform a Perla test and a cardinal gaze test. Okay, so what I'm going to do is I'm going to come right over here. I'm going to check this side. I'm going to let your eyes rest, and I'm going to come back and I'm going to check this side to see if your pupils constrict, okay? Okay, the pupil is constricting, and let the eyes reset. Do it again. Okay, I'm going to let eyes reset, and I'm going to check over here. Okay, and let them reset. Do it one more time. Okay, the pupil's correctly constricted. Now I'm gonna have the patient pick a spot on the wall over here, and I'm gonna check for accommodation, okay? I'm checking to see if your pupils constrict. Okay, the patient's pupils are perfectly round, equal reaction to light. Now I'm gonna do the coronal field of gaze. If you could look at this for me, and just follow it with your eyes, keep your head still. Right, middle, bottom, middle, side, middle, up, middle, up, middle, side, middle, down, middle. Okay, and we are done with the Perla and field of gaze test. Okay, now I'm going to check your conjunctiva on both eyes. The conjunctiva is pink and the sclera is white, and your eyes are symmetrical. Now I'm going to check your nose for any deviations or obstructions. Your nose is midline, no deviations, no obstructions. Now I'm going to check your mouth. If you could open your mouth for me. Okay, the uvula is midline, the tongue is appropriate, there's no missing teeth, no dentures, no foul smelling breath. No ulcers, the mucous membrane is pink and well, and the mouth is not drooping at all. Next, I'm going to check the patient's trachea. The trachea is midline. Now, I am not going to remove his clothing, but I'm going to assess the jugular vein. If you could turn to the left and turn to the right. I would do this at a 45-degree angle with a working pen light. Left, right, okay. The jugular vein is not distended. Okay, now I'm going to check the patient's level of consciousness. If you could sit up for me. Okay, can you tell me what your name is?
Kevin Mills.
Can you tell me where you're at?
At home.
Can you tell me what we're doing?
Head to toe.
And do you know what day it is?
Yes, it's Monday.
Okay, the patient is alert, awake. He is oriented ×4. And we're going to do some range of motions test, okay? Can you shrug your shoulders bilaterally for me? Okay, and if you could do a pronator drift, if you just stick your arms out like this, palms up, eyes closed. Great, if you could squeeze my hands. Perfect, okay. Put your arms back down. If you could point your feet down and back up, we're going to do plantar flexion, dorsiflexion. All right, great. And we're going to do range of motion test real quick. Great. Awesome. Okay, now if I could check your gait as well. Okay, perfect. All right, you can sit down. You can lay back down for me. All right, now I'm going to assess the patient's heart. Okay. I'm going to do your aorta, your pulmonary, your aortic, pulmonary, Erb's point, tricuspid, and mitral. And while I'm here, I'm going to check the patient's apical pulse. I'm going to do this for 1 full minute. Okay, I checked the patient's apical pulse for 1 full minute, and it is at 80 as well, along with all the others. And that is within normal beats per minute, as it is 60 to 100. Next, I'm going to do the patient's lungs. First, I am checking for any chest expansion and for respiratory effort, respiratory expansion. And now I'm going to assess the 6 points on the patient. And also for cardio, I would normally undress the patient or have the patient move his shirt. I would not normally osculate over the patient's clothes. And the same for the lungs as well, front and back. Okay. If you could take a deep breath for me. In and out. 1. In and out. 2. In and out. 3. In and out. 4. In and out. 5. In and out. 6. All right, there is no wheezing stridor, no crackles. I don't hear any obstructions in his lungs. If you could turn and do the back for me so I could osculate the 8 points for your lungs in the back. If you do it, turn a little bit more. Thank you. Okay. If you could go ahead and breathe it out for me. In and out 1, in and out 2, in and out 3, in and out 4, in and out 5, in and out 6, in and out 7, in and out 8. All right. The patient is also free and clear of any stridor, any crackles or wheezing as well. Okay, next I'm also going to do the patient's GI. Have you had any dietary changes recently?
No.
Okay, what was your last meal?
Mexican.
Okay, and when was that?
About an hour ago.
All right, great. So first I'm going to inspect your abdomen without touching. If you can move your arms for me. All right, I'm going to inspect it. There are no stomas, no urostomies, no wounds, nothing that sticks out. So I'm going to start osculating in the right lower quadrant, and I'm going to assess each quadrant clockwise from the right lower quadrant to the left lower quadrant, and I'm going to do that for 1 full minute. If it is below 5 or over 30, that would mean out of limits, and then I would assess for 3 to 5 minutes instead. So I'm now going to osculate, start in the right lower quadrant. Okay, everything seems fine. He is at about a 10, so that is also within normal limits. Now I'm going to take the bell of my stethoscope 1 to 2 inches above the umbilicus and listen for any bruits. Okay, everything was fine there. Now that I have listened and inspected, I'm now going to lightly palpate the patient's abdomen. Is that okay with you? Okay, everything seems fine. There is no distension noted. Okay, so now I'm going to assess the last bowel movement and then move on to the GU. So have you had any changes in urinary frequency, urgency, burning?
No.
No? Okay. And is it okay if I also check to see if your bladder is distended at all by palpating? Okay, I'm now going to palpate the patient's bladder to see if it is distended, and it is not. Okay, and I'm going to reassess your pain level. How are you feeling now?
I'm fine. 0.
0, okay. I wanted to thank you for doing your head to toe with me today. I'm going to place your bed back in the lowest position possible. I'm going to put your side rails up. I'm going to put the call bell within your reach. Is there anything I can do for you to make you more comfortable?
No, I'm fine.
No? Okay, well, please don't hesitate to press the call light. Let me know if you need anything. And I'm going to now take off my gloves, perform hand hygiene. And would you like the curtain open or closed?
Open's fine.
All right, well, thank you so much for today.